The Harris County Commissioner's Court will consider that bird ban at its meeting today without Judge Lena Hidalgo. She's taking a temporary leave from office to receive treatment for clinical depression. Hidalgo says she recently checked into an out-of-state facility for care. Precinct 1 Commissioner Rodney Ellis will run the meeting in her absence.
I think the key here is to remember that at least 1 in 5 people either have experienced or are experiencing themselves clinical depression, and so that means we either know somebody or again we are experiencing ourselves.
Well, Judge Hidalgo has gotten bipartisan support for her decision to openly talk about her mental health. Commissioner Ellis saying, quote, "I want to commend her for making the decision to get the help that she needs," end quote. And, you know, millions of Americans do suffer from clinical depression. So what exactly is the condition and how exactly is it treated?
Joining us this morning is Dr. Robert Boland, Chief of Staff with the Menninger Clinic. Welcome to Houston's Morning Show.
Thanks for having me.
Can you explain what clinical depression is, just completely different than just the everyday blues as they're known?
Sure, and thanks for asking it that way, because that's part of the problem, right, is we all kind of know what blues are, and we all sort of have an image of depression from our regular experiences, but most of us don't encounter the disease of depression, at least not every day, even though Judge Hidalgo is right, and it's very common. Depression really affects every part of our brain. So, of course, we can have the classic depression of feeling sad and down, but all the same, it can also affect our emotions in other ways. For example, we can feel irritable, or perhaps we could just feel nothing at all, kind of apathetic. It also affects our thoughts. It distorts our thoughts. We tend to see the world more negatively. It affects our judgment, which is a good reason for people to take time off and not make major decisions while they're feeling depressed. In the worst cases, we can feel like life isn't worth living. So we can feel suicidal, and we can be at great risk for taking our own lives. It can also affect us in our attention to the point where we might feel that we might start to have a dementing illness sometimes, which fortunately gets better when we get treated. And finally, it also affects us physically. I mean, depression is a disease of the brain, and the brain controls the rest of our body. So it makes sense that it can affect all of our other bodily functions. We notice in most that it can disrupt our sleep, our appetites. It just makes us generally tired and fatigued. And these can occur for different people in different combinations. So even though depression is incredibly common, it's also very sad that many people don't recognize it and don't seek treatment.
So you mentioned taking time off, and that seems like the first step for many people. But what are the other treatment options beyond that?
So there's a lot of good treatments, and that's the good news. The bad news is how common it is. The good news is how treatable it is. As we probably all know, there's many medications for depression. There's discovering new ones all the time that work in different ways. And these medications are incredibly effective as long as people take them. In addition, we also know that there are a number of very targeted psychotherapies. And it's not just kind of like our grandfather's psychotherapy that goes on for long periods of time. There are some very short-term psychotherapies that could be very effective. I would say if it was myself suffering from it, I would probably do both, because the combination does seem to be more effective than either alone. Many of the initial treatments can be evaluated and chosen by your primary care doctors. However, in a lot of cases, people do well to go to a specialist, a mental health specialist, such as a psychiatrist or a psychologist.
Now, we know that a lot of times these crises can happen late at night or when an office isn't readily available to talk to somebody. How important is it for someone to know that crisis hotline 988 and to be able to call it and to get just instant help to make sure that they remain okay until they can get professional help?
Well, thank you so much for bringing that up. And it's good. It's important to have that kind of information at your fingertips, because you don't know when it's going to happen. There are other resources out there as well. And of course, there are the emergency rooms, which are equipped to evaluate and start treatment for depression, or at least get people in the right direction for a treatment if it's a serious crisis. Certainly in a case where a person might be thinking of taking their own lives, they should act immediately.
All right. Well, Dr. Robert Boland, Chief of Staff with the Menninger Clinic, thank you so much for joining us and telling us about this. Such a big issue for people.
Well, thanks for giving me the chance to talk about this important issue.
Thank you.